popular reality TV shows, but he is a board-certified dermatologist. Dr. Will Kirby,
How are
nice
you?
to have you here.
Nice to see you. Thank you for having me.
Oh, we are most pleased to have you here, and it's nice to have an authority on good skincare.
Well, I always tell people the word doctor is derived from the word doctorate, which means to teach. So I love to teach. I love to educate. If you have any calls, I'm happy to answer them. So any information I can provide for you about dermatological skincare that's why I'm here.
And you do travel around quite a bit. You have your own practice in Beverly Hills, a place where most people go, where the most beautiful people in the world are, right?
Absolutely. I tell people if you can make it in Beverly Hills as a dermatologist, you can make it anywhere, because the patients in Beverly Hills are so incredibly discriminating, and that's why we really try to bring them that upper echelon of skincare that Neutrogena Dermatologics provides.
And you're only as good as the skincare that's available to your clients.
Well, I always tell people I'm the least hypocritical dermatologist you'll ever meet. The same products that I recommend for my clients, my patients, those are the same products that my family use, that I use myself.
And it's really impressive that the formulation of this particular Neutrogena product will really begin to deliver the results that maybe you've been waiting for, or other products have promised you and you're not seeing those results. It comes down to the combination of ingredients and the potency and the stabilization and all that other scientific stuff that goes along with it.
100%. And if I could just take one little step backwards really quickly, I want to say Neutrogena Dermatologics is that specialized professional division of Neutrogena. And what that means is they take the regular skincare line that's available to you and they take it to the upper echelon. It's sort of a way to kickstart those products. Like you mentioned, it's professional level solutions, and it's the highest quality ingredients. So it's the specialized professional division.
And it's also something, Dr. Kirby, that you can also layer in with your existing skincare line.
Absolutely. Now I tell people it's exclusive. You can only get it here. This is it's an exclusive product, exclusive product line. But it is very, very powerful, so it should be the first thing that comes in contact with your skin, although you can use it with other products.
And serums are known for their potency. They really do deliver strong results. And at the price of $75, you think, okay, well, how long is this bottle going to last me? And really only a teeny little drop is accurate that'll use?
Exactly. And what people say, what is this product for exactly? Superior anti-aging benefits. This is for people who want to kickstart their anti-aging regime into a higher level, help with all those signs of aging. Softness, luminosity, smoother skin. There's a real beauty message associated with this line, but it's superior anti-aging benefits that give you that youthful, more beautiful appearance, and that's what the product line does.
All right, so as a dermatologist, let's talk about what retinol is, and I know some people may steer away from it quickly because they've heard of maybe side effects or things that can happen using retinol.
There's so many misconceptions out there about retinol. Retinols are loved by dermatologists. I absolutely love retinols, but it has to be formulated in a particular way. Stabilization is an imperative part of that process.
Right.
And when we talk about why we know retinols work, it's not just me as a board-certified dermatologist. There's more than 2,800 publications that testify that retinols are considered a gold standard for any anti-aging regime. The difference is that Neutrogena Dermatologics stabilize their retinol. So, and it's also in combination with the other ingredients within the product. But a stabilized retinol is imperative because that means the strength you're getting on day one is the same strength that you're getting when the bottle runs out. So stabilization is an imperative part of that process, and it really mitigates some of those problems that people have experienced in the past.
Even in the packaging, you'll notice that everything is self-contained in a pump delivery system, so just a little pump, and it is in a metered dose. So what you have that comes out of this pump is what you'll use on the entirety of your face and continue down to your chest and to your neck area too.
You can absolutely use it on the neck, the chest, the décolleté as they call it, or the back of the hands, but a pearl-size amount, the size of a pearl, is enough to cover your entire face. And I tell people this is a full facial product, thin layer to cover the entire face. It's sensitive enough that you can use it around your eyes, which is the most sensitive part of your skin area, but it's also powerful enough to really see that clinical difference. The thing is, though, it's not just that stabilized retinol. It also, the other ingredient in it is tetraol E. What does tetraol E do? Firms, tightens, restores elasticity, and as a result, it's the marriage of those two proprietary ingredients that give this beautiful exclusive formula.
And now, Dr. Kirby, how quickly will we begin to see results? We have a 30-day money-back guarantee here.
Sure.
So.
Well, I tell people that it's really important, and this is where the education process comes in. Any adult skin, the cycle that your skin is on is a 35 to 57-day cycle, and that means that any product you start today, it's going to take a good 6 to 8 weeks to really start seeing that difference. And that's something I really try to emphasize to my patients when you come to my office, which is that if we have to do a skin cancer surgery, you're looking at a good 6 to 8 weeks before you're going to see that heal up well. And it's the same with any skin process, especially the anti-aging process. 6 to 8 weeks is really where you're going to start seeing that difference. And we also have clinical studies to back that up, and I'll talk about those in just a few minutes and give you some statistics.
Yeah, absolutely. And you just touched on that, the skin cell cycle. I know when we're younger, in our teen years, we're baking out in the sun and doing all that, and we're thinking we're invincible. We're never going to grow old, and then something happens within us,
it catches
right?
up with you.
Yeah.
Well, the analogy I make is this, too. I have a brand new baby at home. He is 15 weeks tomorrow, and if you look at his skin, it is flawless. It is absolutely beautiful. If you have a young child in your home, a grandchild, a child, a nephew, niece, look at their skin. Their skin is supple, it's soft, it's smooth. As we age, we lose that. Our skin cycle slows down because children, their cycle is so fast. It's going every maybe 28 days to every 40 days. It's much, much faster. We lose that hue, we lose that humectancy, we lose that resilience that our skin had. And that's what retinols do. Stabilized retinol technology in particular increases that surface cell turnover and gives you a more youthful appearance.
Kind of giving back what we used to have via a serum. And it's really the go-to product, whether you are 18 years old, and there are a lot of teenagers that are in tanning salons and out in the sun and really doing a lot of damage to their skin and not preventing it, not moisturizing and not doing it. This is actually preventative, as well as even if you're 60 and on up, you can still use it.
Oh, absolutely. I mean, I have patients who range, like you said, 18 is really the youngest I recommend for retinol.
Right.
You should use a broad spectrum sunscreen every day, avoid the damaging sun, but the stabilized retinol technology with Tetrelli is an imperative part of any anti-aging regime. No matter what you're using, let's say you have products you like, wonderful. You need to have a stabilized retinol technology in your regime.
No.
If you have a medicine cabinet and it's full of products you don't like, there's a reason for that. They're not working, and you need to simplify things and use a product line that works.
Well, Neutrogena is a name that's been around for years and years. I mean, your mothers and maybe grandmothers have been using it too, and now it's evolved into the next generation, which is dermatologics. So this is another an area that you need to really consider, is that if you're not ready or you don't feel comfortable getting a prescription because you're worried about the side effects, maybe with your existing prescriptions, or you have skin sensitivities, it is that in-between stage before the next level, right?
Well, I mean, it really depends on how you want to define it. I mean, once again, I have access to every single product available, and this is what I use every single day. So I'm a full broad spectrum dermatologist. I do cosmetic dermatology, clinical dermatology, surgical dermatology. For my anti-aging patients, which is a vast majority of my patients in Beverly Hills, Neutrogena Dermatologics is what I recommend, and it's what I use on my own face.
Yeah, well,
so I wouldn't
you're looking
use it.
young.
Thank you very much. I wouldn't use it if I didn't think it wasn't first-class gold standard line.
And speaking of gold, you can see just a little hue of yellow in the actual serum.
This is this is another great. We'll be real still here. This is enough to cover your entire face. And I know if you're watching, you say, "Oh, Dr. Kirby, that's not very much at all." That I assure you, that is all you need. A pearl-size amount is enough to cover your entire face because it's actually very powerful. And if you know, it goes on very smooth. It is a serum, absorbs very quickly, provides you with that humectancy very, very quickly. Maybe we could pull up some of the statistics
Actually,
in our clinical
yes, we'll
study
go
and
right
talk
to
about
that. And I'm just talking, before the show on that. And yes, being a practicing dermatologist in Beverly Hills, where plastic surgery is rampant, you still need to have good skincare, even if you have had plastic surgery.
I mean, if you need a lift, and maybe you will one day, that doesn't change the quality of your skin.
Yeah.
But in the clinical studies that we have, with even the first use, you have a lifted appearance in as fast as 2 minutes, and that's testament to that superior hydration there. And that hydration per use will last up to 24 hours, and that's always a concern people have is the level of hydration that they're going to have. After 4 weeks, that's when the results really start to kick in. 97% of users, and this is in a clinical study with dermatologists, showed improvement in the appearance of crow's feet and fine lines. 89% of users showed improvement in the appearance of stubborn forehead wrinkles. So that's after just 4 weeks. When you're talking about 97%, that's nearly everyone. And we talked about that skin cell cycle. It takes about 6 to 8 weeks to really kick in. 70% after 8 weeks of users in this clinical study showed improvement in the appearance of stubborn under the eye wrinkles. So when you talk about forehead wrinkles, eye wrinkles, fine lines, that's really the vast majority of the aging skin that people worry about.
Well, we're going to be using this when? In the morning or in the night? When's best?
Well, I'll tell you that when I use it, and once again, you can follow my lead, I use a pearl-size amount every single night, just because that's the regime I like and that works best for me. If you want to use it during the day, you're absolutely welcome to. It's the first thing that needs to come in contact with your skin, and you should use it with a broad-spectrum sunscreen.
Oh, I was going to say, is there any sun sensitivities to using this particular retinol?
This isn't going to make you any anti-aging, any skin skincare regime at all can make you more sun sensitive. This in particular doesn't make you more sun sensitive than any other products out there. That said, as a dermatologist, I'd be doing you a disservice if I didn't say, you know, please, I implore you, wear your broad spectrum sunscreen every single day.
Right, yeah, and I know that many of us don't do that, and we don't wear sunglasses, but it's good to know that there's something like this that can still help us no matter how far along the aging trail we are. Here's a look at what happens beneath the skin.
Yeah, this is a demonstration of how it works. The retinol enters the skin, it penetrates through that stratum corneum, that upper layer of skin, increases surface cell turnover, and it diminishes the look of the fine lines and wrinkles that you see on anyone's face.
Having a good skin cleanser and a good toner is also something to use.
I tell people the beauty of this product line is that less is more. You need to do very, very few things. You know, people often get confused by the amount of steps they have to take with their skincare line, and I tell them the most important thing is the quality of ingredients that are being applied to the skin. When you talk about stabilized retinol technology, when you talk about Tetrol E, those are upper echelon ingredients, and those are much more important than the other things you can use. If you like a cleanser, wonderful, use your cleanser. It doesn't really matter to me. Cleansing is not as important as people often emphasize.
I know, and it's often a lot simpler than we sort of.
Oh, it's so people they have steps and all these combinations. It's very, very simple. I tell people it's common sense technology. Start with just a thin layer every single night of a high quality product.
And the high quality we're talking about today is a company that has been around for 40 years. It's a name that dermatologists worldwide suggest for their clients, not just Dr. Kirby, but other dermatologists too.
Neutrogena itself has been around for 40 years and available in 70 countries. And this is Neutrogena Dermatologics, that specialized professional division. So it takes the technology you already know and love, and it takes it to the upper level, really kickstarts your anti-aging regime.
And it's great that you can use it with your existing product line. So if you have just bought an entire line of skin cleanser and toner and a moisturizer from a line here at the shopping channel, you think, wow, can I incorporate the serum? Absolutely.
Of course, if you already have products you like you said, absolutely. As a dermatologist, I will tell you firsthand, and this is not just here today. Stop me at the airport, come to my office in Beverly Hills, wherever you see me. Stabilized retinol technology, Tetrol E, it's an imperative part of any anti-aging regime.
And it's really important.
I can't emphasize it enough. It's imperative. It's not even that it's important. Everything else is secondary when you talk about the quality of ingredients that are available.
And the alternatives, Dr. Kirby, to fighting the signs of aging may be steps that women are not comfortable with yet, like in order to diminish wrinkles, you know, up to 90% on your forehead, stubborn wrinkles. A lot of women are choosing alternatives like Botox, and some are not still comfortable with maybe using that.
Well, I tell absolutely everybody that I talk to about skincare, which is quite a few people, that you have to build a hierarchy. And that hierarchy starts, number one, with a broad spectrum sunscreen every single day and avoiding bad burns, avoiding that harsh sun of the summer. But also you want to avoid incidental sun during the course of the year. Number two, stabilized retinol technology. Everything else that you use falls down that hierarchy. And that's not to say that things aren't great in there. There's a lot of procedures that people do that are wonderful, but they're not as important as that broad spectrum sunscreen and that stabilized retinol technology.
And that's what we're having here. And if you're someone like myself who spends most of her summer out on the water and you're enjoying it, because here in Canada, summer is so fast and so fleeting, Dr. Kirby, that we're out there from as soon as the sun shines, we run out, and we can't help ourselves because it so quickly leaves us. You don't have to change your lifestyle. You just have to incorporate one product into it to help circumvent any of those problems that can happen from sun damage, because it is accurate. You do get damage from the sun.
Oh, 100%. That's not even in question. I mean, the sun is obviously is terrible for the quality of your skin.
It's a great feeling.
It feels good, but
it feels good.
And the thing is, you know, it's not that you don't have to live in a cave, but a broad spectrum sunscreen is really what you need to use.
And it won't counteract the effects of the retinol either.
Now, the retinol is cumulative over time as well. So the stabilized retinol technology with that Tetrol E, I mean, once again, it's not just my opinion. Check the clinical studies. Ask dermatologists. They will tell you that people agree. This is more than 2,800 publications testified to the fact that retinol is a gold standard for any anti-aging regime.
How many, do we have about a month's supply in here?
No, this is a 60-day supply.
Wow,
so we talk about that. We talk about that 35 to 57-day skin adult cycle turnover.
Right.
One bottle is enough to really start seeing a difference. By the end of using one bottle, people will give you compliments on their skin. They'll say to you, you look more rested, you look relaxed, you look refreshed, because it takes that 35 to 57-day period to really see that difference.
That's funny. Looking more well-rested, even though the majority of women run on 5 or even 4 to 6 hours of sleep a day. And men are falling into that category too as well. And we're looking for ways in which to better our health, better our appearance. And with it being more and more difficult in the world to compete with younger people, it's nice to know that there's a product that can actually help us out.
Oh, 100%. I mean, I think it's sort of relative to how you live your life. And
right.
It used to be that, you know, lines and wrinkles were distinguished and often implied wisdom. And now, my opinion is that we should really fight the aging process. And that's really what we do, is we take the necessary steps to, you know, not drastic measures by any means, but just a very simple, probably adds 30 seconds to your day, very simple step to really fight that aging process.
And if it's something that's so simple and we're going to really reap the benefits of it, why not use a product like the Dermatologist Retinol NX, where